Hi everyone. Today I am going to present the fourth session on drug action. Let us see the physiological action of some more important drugs. Today the first drug is Crotalus horridus. Crotalus horridus is from the family Vipidae. Potentially, it is one of North America's most dangerous snake due to its long fangs, impressive size, and high venom yield. Commonly known as timber rattlesnake, canebrake rattlesnake, or banded rattlesnake. It is a species of venomous pit viper endemic to eastern North America. The venom extracted from the poison gland is triturated. This agent, when introduced into the system, at once produces an increase in the pulse rate which may rise to 150. There is soon a slowing to 75 and again to rise to 100. During this time, there are pain in the chest, throat and limbs. There are flashes of heat over the body which are speedily followed by sensations of cold chills. The tissue about a wound becomes edematous. The skin changes to a red color and while later it is of a purple hue. There is a great muscular debility and gradually developing state of coma. The blood is rapidly decomposed and will not coagulate. There are hemorrhages from all the orifices of the body. The finger and toenails become discolored and blood flow underneath them. There is a bloody greenish froth upon the lips. The death ensues. The main therapeutic indications are pyemia, septicemia, purpura hemorrhagica, epistaxis, dysmenorrhea, hemorrhages, and a tendency to carbuncles, etc. The next drug is Gelsemium. The genus Gelsemium belongs to the family Loganaceae. Gelsemium sempervirens is a highly poisonous vine in the southern United States and is also cultivated. Gelsemium also is known as yellow or Carolina jasmine, wild yellow or Carolina jasmine, and evening trumpet flower. An alkaloid, gelsimicin, from the Gelsemium sempervirens is toxic, and the symptoms of toxicity are depressed respiration, tremors, paralysis of extremities, convulsions, urination, defecation, retching, and salivation. The mother tincture is prepared from the fresh roots. This agent is toxic, does produce paralysis of the root of the motor cerebral nerves and the motor areas of the spinal cord as a result of paralysis of all muscles of the body. This is followed by cutaneous anesthesia, convulsions in animals and at times in man. The breathing is rendered slower and shallower and is frequently irregular. Death results from asphyxia due to depression and ultimately paralysis of the respiratory center. The heart's action is reduced. The pulse is lower, weaker, and then normal, while the arterial tension is lowered. The temperature is reduced. Through its action on the third cranial nerve, mydriasis and ptosis result. The sixth nerve may be affected when convergent strabismus may result in diplopia and dimness of vision. There is extreme muscular weakness and prostration, while the patient is drowsy, but the mind is not affected till carbonic acid narcosis takes place. The main therapeutic indications of Gelsemium sempervirens are measles, cerebrospinal fever, dysmenorrhea, vertigo, diarrhea from emotional excitement, fever, headache, etc. The next drug is Glonine. The Italian chemist Cerbero first manufactured nitroglycerin in 1846 by combining nitric and sulfuric acid with glycerin. Nitroglycerin its possible value as a therapeutic agent was first investigated by Constantine Herring, a homeopathic physician. Common name nitroglycerin, a light yellow oily liquid. This agent increases the pulse rate and produces a general thrombing of the vessels. The throbbing is most marked in the head and gradually become worse till there is a violent bursting frontal headache with giddiness, the fullness of the head, flushed face, and sensation of constriction of the throat, accompanied by vomiting, faintness, and complete insensibility. Large doses occasion heart failure in diastole. Some of the main therapeutic indications are flashes of heat at the climax, throbbing headache, effects of sunstroke, sun headache, increase and decreases with the sun, etc. Sun headache that increases and decreases with the sun, etc. The next drug is Hydasis canadensis. Hydasis canadensis is a slow-growing perennial herb from the family Ranunculaceae. Hydasis is a native to the woodland of the eastern United States and southern Canada. Golden seal, yellow root, yellow pecan, ground raspberry, eye balm, Indian turmeric are the common names. The alkaloids berberine, canadinin, and hydrastinine are believed to be responsible for golden seal's medicine's activity. The mother tincture is prepared from the fresh roots. This agent is a stomachic and intestinal tonic, increasing the secretion of the gastric and intestinal juices and promoting the appetite. It increases the peristaltic action of the stomach and intestinal walls, increasing their muscular tone and favors a more normal evacuations of the bowels. It has stimulating influences upon the myocardium. A similar action is observed upon the muscles in general. It is deranging the digestion and the constipation's result. It is also protoplasmic poison, arresting the movements of the white blood corpuscles. It contains two alkaloids, hydrazines, which is considered the identical with the barbine, and act as a tonic, antiperiodic, and cause ringing in the ears, and hydrazines, which affects the mucous membrane. These alkaloids, while not toxic in medical doses, have produced death in the larger animals. These were convulsions, decreased blood pressure, and failure of the heart in diastole. The elimination of this agent is largely through the kidneys. The main therapeutic indications of Hydasis canadensis is debility and general weakness, jaundice, cholelithiasis, constipation, aphthous ulcers, fissured nipple, ulceration of the skin, ulcerative stage of leprosy, cancer, gonorrhea, etc. The next drug is Hyoscyamus niger. Hyoscyamus niger, commonly known as henbane, black henbane, stinging nightshade, etc. And this plant is poisonous in large quantities and is from the family Solanaceae. It is native to temperate Europe and Siberia and a naturalizer in the British Isles. It contains two alkaloids, hyoscyamin and hyoscine. The mother tincture is prepared from the fresh plant of the second years of growth. While in its action, this agent has many points in common with the belladonna and stramonium. Yet, each has its individuality its own. Hyoscyamus does not produce intense cerebral congestion and inflammation of belladonna, nor the intense maniacal delirium and sensorial excitement of stramonium. It produces a sensation of fullness and heat of the head, with the flushed face without pronounced hyperemia, indistinct cold vision, which may approach complete blindness, and owing to its stimulating action upon the sympathetic nerves, the pupils are dilated. There is giddiness and delirium that resembles drunkenness and hallucination. The delirium is apt to be accompanied by insomnia in some cases. There is an incoherent muttering, such as accompanied typhoid fever. The habitual use of this drug is an incoherent muttering delirium of a violent character. The secretion of the respiratory tract is diminished and a dry, spasmodic cough result. Some of the main therapeutic indication of Hyoscyamus niger is delirium, typhoid fever, cerebrospinal fever, cerebrospinal meningitis, infantile convulsions, insomnia, purpural convulsions, etc. The next drug is Kali bichromicum. It is a crystalline ionic solid with a very bright red-orange color, commonly known as bichromate of potassium. This agent, when applied locally, is an irritant, caustic, and is an antiseptic in the proportion of 11 to 909. Internally, it is an expectorant and emetic. These secretions of the mucous surface area increase are tough and stringy. False membranes are formed with a tendency to ulceration. The ulcers are round with a well-defined edge and a tendency to perforate. Some of the main therapeutic indications are neuralgic headache, laryngitis, diphtheria, chronic bronchitis, tonsillitis, gastric ulcer, leukorrhea, etc. The next drug is lachesis. Lachesis mutant, also known as Surucucus snake, Southern American bushmaster or Atlantic bushmaster, etc. This is a venomous pit viper species found in South America as well as the island of Trinidad in the Caribbean. Preparation of this drug is trituration of the venom extracted from the live snake. This agent produces irritation of the larynx, trachea and heart. The blood is decomposed and hemorrhage result. A low asthenic condition is developed, which is followed by convulsions and unconsciousness. Some of the main therapeutic indications of lachesis are headache, chronic pharyngitis, laryngitis, diphtheria, congestion of the left ovary, diarrhea, constipation, pneumonia, etc. Now let me conclude for the time being. The remaining portion of the chapter, drug action, will continue in the next section. See you in the next section. Till then, goodbye.
Thanks for watching.
Like,
Comments
share,
and
subscribe.